I'm going to focus my presentation on a measure of fidelity that enables us to know whether or not, once we transfer our evidence-based practice into the community, it is being conducted with fidelity, and then checking whether or not that fidelity is producing the kinds of outcomes that it did when we were in the ivory tower developing this program and under perfect control conditions. So when you, as we all know, when you take a empirically based program that is developed under very carefully controlled conditions, when you take it into the community, things can start to fall apart. Just a brief message about what this program is. It's a theory-based social interaction learning theory, and it is based on development over approximately 50 years at the Oregon Social Learning Center with Jerry Patterson and all our colleagues there testing the program and developing it. And it's like Kimberly was mentioning earlier, it focuses on the child within the ecology that surrounds the family, but we see the family as the most important dimension of protecting the child and helping the child's development. So we've conducted at OSLC a number of randomized controlled trials with a variety of samples, testing whether or not the parenting practices that are the components of our intervention do indeed change, and if that indeed changes the child outcomes. So we're using mediational modeling, in which we show that random assignment affects child outcomes, but that is explained through the various, through the mediator of parenting practices. So we get a variety of important child outcomes, and the nice thing that we find is we get collateral effects of on positive parent outcomes. I'm not going to talk about the model anymore because I want to talk about the approach that we take to implementation. It is through full transfer, in which we actually transfer the program to the adopting community so that the control is placed into the hands of the community. That requires the development of an infrastructure that is led by a community governing authority, and their task is to maintain model fidelity and maintain effective treatment outcomes. This approach has really operated through, it starts with a visionary leader or group who are committed to effecting lasting change. Now, this person or these people have to have strong social and political capital and the resources to make it happen, and they also have to have longevity. That is, they're not here today and gone tomorrow, because if they're not able to pass it on effectively, it dies. I'm sure you're all aware of that. So it starts at the top, but it's sustained at the bottom by the families and the practitioners who are satisfied with the method and the outcomes. So now I'm going to focus on the fidelity measure. We call it the fidelity of implementation, fondly called FIMP. And it's based on direct observations of therapy sessions. And it scores both adherence to the model and competence. This full transfer approach that we do has tremendous capacity for improving reach. So if you see over in the left-hand side this little tiny white dot and the number 29, that is the number of practitioners that we trained in Norway in the first generation. Since then, and they were first certified in 2001. Since then, they have trained 300 clinicians in the full heavy-duty model of PMTO. And they have also trained 1,200 in a prevention mode that's provided to families in clinics. 25,000 families at this point have been treated in Norway with PMTO, and so you see this tiny little group that we train transferring the model into the hands of the community enables them to have tremendous reach. And we have implementations now in many places, except you see over here on the left Oregon. Of course, we're not in Oregon. You never are particularly popular in your own home state, I take it. So we spend a lot of time training. And in fact, our training is maybe obsessive-compulsive in that these are the people who carry the program forward, so they have to know the model and they have to know the procedures really well so that they're able to pass them on. On the top left, we've got Mexico City. On the top right is very interesting. We have Liz Wheeling, who is doing a pilot with mothers, displaced mothers in northern Uganda. In the center is New York City. On the bottom left is the Netherlands. And in Detroit, we have very happy trainees who are participating in the program. Okay, so now to the measure itself, the fidelity of implementation. As I said, it's based on direct observation of therapy sessions. We tend to focus on 4 sessions, both kinds of contingencies, that is teaching skill encouragement through positive reinforcement and setting limits on deviant behavior through discipline practices. These sessions are both the introduction and troubleshooting. That is, after they've tried it, how do you troubleshoot it? Our emphasis is on knowledge. That is the content of the intervention, and structure. How do they deliver it specifically, following an agenda, yet being responsive to the family? That we would call, those 2 measures are primarily in terms of adherence. Teaching process and overall are dimensions in which we focus on how competently the intervention is delivered. And by the way, the only people who are able to score FIMP are certified therapists, because we believe those are the only people who can ensure that competence is being assessed. We we use technology to the hilt, and we have what we call FIMP Central, which is actually a database and portal located in the Netherlands, and our videotapes of sessions are kept on a secure, HIPAA-secure portal where the coders can access the video on the portal and make their ratings, and then the ratings are retained on the portal, and the supervisors of the coding teams are able to assess reliability. And then we have reliability meetings, which we're also able to do virtually, where the woman on the bottom in the center is the leader of the reliability assessment, and we have people here in St. Louis and Mexico City and in Michigan all participating in this fidelity training or reliability training. So we use them for multiple purposes: to train and coach, to evaluate the training and to evaluate certification, and to focus on whether or not we have drift across generations. When you have a full transfer, as we're doing here, you want to be sure that you're not drifting away from the model. And also to assess whether or not fidelity is indeed predicting improved parenting, the mechanisms of change, and child outcomes. So I have a bit of data on that for you. Looking at the extent to which fidelity predicts change in parenting and change in child outcomes. So this figure represents two studies, a teeny tiny efficacy trial with 4 therapists and 20 families, and an effectiveness trial nationwide conducted in Norway with a clinical sample. And there were 114 therapists, so we go from 4 to 114, from 20 families to 238, and see whether or not in a different culture, in a different language, in the community settings, whether or not the fidelity measure will predict changes in observed parenting. That's parenting observed before and after intervention through parent-child interactions. And we look separately at mothers and at fathers. The numbers on the top are the prevention sample, and the numbers on the bottom are the efficacy or the effectiveness trial. And you can see the beautiful dark lines showing that indeed fidelity assessed during treatment predicts change in observed parenting before and after treatment. We're very pleased with those findings, and it said, yes, our fidelity measure is indeed predicting the mechanism of change in our model. Now, in Norway, they did another test of fidelity, and it's looking at change in problem behavior reported by parents before and after treatment. And fidelity was assessed by the FIMP score 3 times in sessions 3, 12, and 20. And at the same time, parents rated therapeutic alliance at those same times, sessions 3, 12, and 20. And what we find is that FIMP predicts improvement in parent report of children's problem behavior. And parent-rated therapeutic alliance predicts change in problem behavior, but negatively. We were pretty surprised by that, as were the Norwegians and probably everyone else. This was published, by the way, in JCCP. So we're able to show that we have strong predictive validity for FIMP for both changes in observed parenting and parent report of child behavior. The big question when you're doing a full transfer of the model from the purveyor, those of us who think we really know how to do it, and the community, is won't you have drift? Won't they provide the intervention less effectively, and won't it get worse and worse with each new generation that they train? So G1 is generation 1. That's the generation we train. And generation 2 is the first generation they train, and then they train all subsequent generations. So here's some data from 3 of our implementation sites, Norway, Iceland, and Denmark. And here is the generation 1 that we trained in their fidelity scores. By the way, in the center you see at 6, a blue line that's indicating that's the certification level. Anything at 7 and above is what we call good work. The score, the range goes from 0 to 9, and 6 is at certification level. So you can see, by the way, with each subsequent implementation trained, you're getting better scores at certification on fidelity. At generation 2, when they do the training, you see a significant, and this is significant, drop in fidelity scores, although they're still at certification level. And that's true in each implementation in Norway, Iceland, and Denmark. But at generation 3, lo and behold, they have recovered to the same level that they obtained in that we obtained in generation 1. So there is a dip when they first take over the training, but then they recover. And we have generation 4 data for Iceland and the Netherlands showing that it holds, especially well for Iceland. There's a bit of a drop in Denmark, but they recover and they sustain it over 6 generations. So, how much time do I have? I can stop there, actually, because then that will, since I'm not able to hear you or communicate with you in any other way than from me to you, I'll stop there by saying that we developed this measure, we tested it, we showed that it has predictive validity. It predicts both change in parenting practices and change in child adjustment as reported by parents. We're able to collect these data worldwide, well, in many implementations, including, by the way, we're doing it in Uganda, and they're doing it without electricity, so they had solar-operated video cameras that they later send material. So it's exciting that it can be done. You can have direct observation of fidelity, and then you can know whether or not for sure the program is drifting.